Welcome to the Westin MCAT podcast with your hosts, Eric Olson
and Jayden Garcia.
Welcome back to the Westin MCAT podcast with your hosts, Eric and Jayden. I think my name says Ahmed. I'm on Ahmed's account right now, so I apologize for that. But it is indeed Eric. I haven't, changed my whole look.
Your hair got shorter, Eric.
My hair got shorter.
To Ahmed, so it could
fit. This is kind of a rarer occurrence now that we're having an episode without Ahmed. He's kind of our rock, but he's super busy with med school and tearing it up with all the stuff that he's been getting up to and the squash. And I think he's really getting into shadowing right now, and I don't know, I'll be interested to talk to him about that when he gets back.
Yeah, lots of things as I've been discussing with him that I am sort of glad I'm done doing, but also exciting for him for the first time going through all of this.
Yeah.
I know. Go ahead. Sorry.
I was going to say, it brings you back a little bit,
Yeah.
And for a lot of our listeners, it's like an exciting glimpse of what's coming, right?
Yeah. No, it is. I kind of feel like a guest on the show right now. It's been a while to kind of get a hold of me. So
yeah, well, so we have an interesting episode, and an idea that Jayden had really was to talk about some of dealing with failure and some of the shortcomings we have. We go about that, but since I don't know when you've last talked with Ahmed, Jayden, but I haven't heard from you in a little while, and I don't know how much you've been able to tell the listeners, but what's keeping you busy? How are things going?
Yeah, things have been pretty exciting and busy. I am wrapping up what is thought to be my busiest rotation in all of residency.
All of residency, really? I didn't know that.
Yeah, I mean, I think there are harder times, more responsibility, probably overall more work, but that comes at a later stage when you're also more experienced too. And so I think it's relatively the hardest when you consider your stage in training.
Yeah.
Probably the most hours worked in all of residency. So it's super exciting to be finishing that.
You're almost done. Remind us what that rotation is.
Yeah, so that's our pediatric ear, nose, and throat surgery service. Kind of a catch-all, but we take care of a lot of sick kids in the pediatric ICU and the neonatal ICU with various breathing disorders, and the list of patients can become quite long. And it makes for pretty early hours. But, it's been so much learning, I think, whenever you're working really, really hard. But yeah, I've been really excited, Eric. What have you been up to before we kind of jump in? It's been a while.
Yeah, well, I'm coming off a pathology rotation, which I've talked about a couple of times on the show, where we spend, not all of our time, but probably maybe like 3 out of 5 days in a week, we're at like in the path lab looking at slides under the microscope, which, as I imagine was your experience, is like something that you hardly or if ever did at all during med school. So it's kind of like learning a new language, and then like just pattern recognition of different things that you're looking at. And then I actually, and I don't think I mentioned this to you, but this is my first week of call right now. So I'm on call right now. I'm on home call.
This guy can leave at any moment.
Yeah, I could have to run out the door at any moment. In dermatology, so for the listeners, different specialties have their call responsibilities, which is kind of like when you're the emergency person, the emergency contact for your specialty. And I believe, Jayden, you correct me if I'm wrong, but I think probably for you guys are like in-house, so you're in the hospital for some period of time, if it's like 24 hours or whatever the case may be, and like you're getting the emergency pages, and everything that goes wrong is coming through you. In dermatology, it's a little bit different. We take call a week at a time, and we don't have to be in the hospital because there are fewer instances no instances where we have to like be there right this second,
Yeah.
and then instances where like, that we're getting pages overnight and things like that can be handled often from home. And then occasionally I'll have to go in. So I'm 3 days in to my first week of call, and I actually scheduled myself for 2 weeks in a row. So we'll see how things are going by the end of the week. I think, people say like, don't do 2 weeks of call in a row. Like it's miserable. But we had a conversation. I don't remember if it was on air or not, where you told me about some of your call responsibilities, and you were
Yep.
like, it's just people who can't breathe and like need urgent surgical intervention, and people coding and people who are sick and this, that, and the other. And so I think I have tried to measure my call expectations against that. Uh, Meaning that like basically no matter what happens to me, it's not going to be as bad as your call, right? So it's been pretty light, although I have gotten a few
Yeah.
calls. But it's kind of an exciting time.
I don't know, every specialty is just so different in what they experience during this time. It's a very bittersweet thing to have, emergencies happening when you're on call inside the hospital. I've obviously had moments of wanting to complain about it, but I mean, just a quick brief aside, there was a moment a couple of weeks ago where there was a lady who got really sick very fast, and I was able to intervene, and it ended up saving her life. And it was really cool because I mean, I think many of my other co-residents could have done the same thing, but they took time at ground rounds to like offer me this pin. It's like a little baby scalpel. I don't have it on my person now, but it's on my lanyard at work, and it's for every time a resident like in our program does something to save a person's life. Um, those are given out, and it's my first one, so it was incredibly meaningful that all this training that we go through. We're primarily talking to pre-medical students, but it's not too long before they're going to have enough expertise in something to potentially save somebody's life. And it's not something I thought would happen, when we were sitting in biology together back, not feels like not too long ago, that we would both get to this point where people turn to us in many ways to either save their life or make their life incredibly better from a health perspective. So kind of
Yeah,
cool.
that's a great experience. Very cool. Thanks for sharing.
Yeah, man. But they don't
Um,
always turn out that way, which is kind
I,
of
I was gonna
it,
say, yeah,
the
yeah,
inspiration, I think, for the episode. I can tell our listeners, Ahmed had reached out to me a little over a week ago wanting to put together an episode, and I had had a really bad day um, where I felt like I just couldn't do anything right. And it was a day where you probably chalk it up as like, I really failed today. And I thought it to be a great topic for everybody listening, because it's not just in residency. We've had, Eric, we've had failures since undergrad, moments where you feel like you're just inadequate. And I think it's worth talking about, because the sooner you get over that, or at least use it to your benefit, the more powerful and more you grow as a human being, but also as like a medical student or pre-med student. So I guess to start, is there any times that you can recall in your journey so far where you've felt like you failed, you were inadequate in some way?
yes,
Yes, yes, yes.
yeah, multiple times. Yeah.
You mind sharing?
Um,
I'm
no,
curious,
yeah. I mean, I
because we don't
have.
talk about these things very much. So I don't even know what you would consider your failures, even though we've been close friends for a while.
I mean, I always come back to this experience I had. Well, I'll start with one that's more recent. That just happened a couple of weeks ago. That I had a patient in clinic, and uh, she needed some biopsies done, and so I, you know, took some biopsies, which basically, in dermatology clinic is like you're taking a little piece of skin, right? So you just numb up the skin, and then you use a little kind of razor blade to scoop off a little piece and then send it off to the lab, and all is good. It's pretty straightforward. We do it, all day. So not anything out of the ordinary for me. And after the fact, you'll laugh when I get to the end of this, because after the fact, she ended up sending a message and saying, like, oh, I'm still having a little bit of pain. And I said, let's watch it for another 24 hours and see how it goes. And then the next day, I think I was off, and she messaged again. And the resident who was on call at the time sent in some antibacterial ointment. And then she messaged again a few days later and was like, oh, my biopsy sites are really bad. And, they've gotten, I think, infected and ended up getting on oral antibiotics. Not like a huge thing, right? Not a huge thing, but had an infection because of this biopsy. And it ended up going, the reason I think you're going to laugh is because this was our morbidity and mortality conference. It's like this case, that was like the most, like the worst adverse event we had in our department. We all have these conferences of morbidity and mortality of like, something goes wrong and how do we fix it, basically. And we have a discussion as a department. And in, a specialty like ENT, I imagine the M&M conferences are like, something happened and the patient died. And so, what went on here? But for us, it was like this patient got an infection. Kind of a minor thing comparatively, but it's like you're in grand rounds. You're in with the whole department, and everyone's like, what did you do wrong? What happened here? And part of the discussion was about, in fact, we didn't even talk about like biopsy technique or anything like that, because I think the assumption was like, sometimes infections happen. There's nothing you can really do. We all know how to take a biopsy in, a clean fashion. And the conversation was more about like, how do you handle these things after the fact? And like, at what point are you sending something in, or at what point are you telling them they need to come in and be seen, things like that, all of which steps I'd failed at. So I think, it was ultimately a good, I'm not going to forget it, even though, again, it was like kind of a little thing, but it meant something to that patient. And she was very upset afterwards. But like, I didn't know any better, like, I don't know how to manage these things when people come back and when they have complications and things. Like, you just don't really know until you do it. Right. And so I think, I won't get into like the lessons quite yet, but the other failure thing that I'll share, that I may have shared before, because it just comes up for me. Like, it's so memorable, and it's such a silly thing as well. But I worked in this lab, and over the summer, like, my assignment for the lab was to do a Western blot. Sorry, I've got a pen in my hand. You can't really tell.
It's like the Matrix.
Just to do a Western blot, which everyone should know, hopefully, if we're studying for the MCAT, right? It's like a protein quantification assay. And you like do all these steps to like isolate the protein and then get it into like the right aliquots or whatever. And then you aliquot it out onto the gel, and then you run it through a current through it, I should say. And then you have to like develop it in a dark room. At least that's how we were doing it. And I must have done it like, and when I say done it, I mean starting with like growing the cells, like starting with growing the cells and then, harvesting them and doing I probably did it like 8 times, which each time takes like probably close to a week because of like the time it took to grow the cells and everything. And every time it was just like a disaster. And I thought I was doing everything completely correctly. Like, I had done it a couple times with a supervisor initially, and then they kind of turned me loose to do this on my own. And I thought it was like going fine. I could not figure out, like, I reread the protocols, and it just was not working. And the readouts that I was getting, like, and you guys hopefully know what kind of Western blot looks like. It's maybe not the highest yield thing to know like what the readout looks like, but it's basically these little bands, right, on a film that show like whether or not there was protein present, and you're staining with an antibody to like show fluorescence or whatever. And it was just like noise, like white, like scatter all across this film, and I couldn't figure out what was going wrong. And it turned out that I was at a certain point, you're supposed to like quantify how much protein is going in each one of these wells on the gel. Are you following me?
Yeah.
And you use like a spectrophotometer to determine like the concentration of protein. And you're trying to like do a calculation to say like I want, 500 nanograms of protein or micrograms or whatever in each well total. And then I'm going to see, what comes out of it. And somehow I was doing the calculation wrong. Like the number that was coming out was like a representative number that you had to then like decode using some sort of other calculation. And I thought that it was giving me like exactly micrograms per milliliter or whatever. I don't know. It doesn't really matter. The point of the point was that like I was calculating it wrong. The number I had was wrong. And I was putting like 2,000 times as much protein as I was supposed to in each well. And so it was like impossible for the thing to stain because there was just so much protein everywhere that it was just a mess. Anyway, like I said, I worked on it for weeks, and finally I finished. Finally I asked someone for help. I was like, I've done this like so many times, and I like cannot figure out for the life of me what's going wrong. And in fact, I had someone help me, and they walked me through all the steps except for a couple, one of which was this calculation step because it was so straightforward that they were like, oh, obviously he's not messing that up, right? And so I had someone walk me through it. I still messed it up. Then we walked through it together, the entire thing, and they were like, oh, it's this one little thing, right?
Yeah.
And I think it was like, it was a good experience for me because I had not really failed so hard at something before. And again, like this was not a make or break thing for that project. It was part of the project, but it wasn't like everyone was waiting on me to finish that step. But like I think I looked pretty foolish, like people kind of laughed at me afterwards in a good-hearted way. But I was like, this was like you really were a loser on this, Eric. And it was helpful to like have to go to someone for help. And I think that stuck with me. To like you don't know things until you know them. And you can't expect yourself to be like perfect at everything. And so it was a good experience for me to have that necessity of going to someone else. Like I tried it so many times and I just could not. Like there was no way I was going to do it on my own. And I think that kind of carries over into other things, and especially, in medical training as we move forward, like you just don't know it all. You don't know it until you've learned it. And so you have to give yourself some grace and say, I will allow myself to rely on other people because you aren't able to do everything on your own. Sorry, that was a lot. That was a lot of talk.
So many principles from that I hope we can kind of start to break down. Yeah, I mean, I definitely resonate with some of those feelings. I think some of the feelings you were experiencing are kind of common feelings that we all feel in these moments of feeling silly or inadequate. What started my whole terrible day last week, I have put in probably a 50 to 75 ear tubes, if not more. That procedure feels very routine to me. There can be tough ones on like very challenging trisomy 21 ears or things like that. But one of the feared things you can do in that procedure is make a hole in the eardrum. And when you're putting in the tube, you push it too far and it gets lost behind the eardrum. And I have thought long and hard about what would happen to me in that moment or how I'd feel if that happened. And last week it happened. And I was very angry because I felt like there were so many things I could easily just blame it on. But I kept coming back to like, I need to own this. And it was embarrassing, right? I mean, we had to tell the anesthesiologist, yeah, we're not done with this 2-minute case because the resident dunked the ear tube behind the drum and now the attending is going to have to fish it out. She was trying to fish it out forever. I was so sitting there praying that she would get it. The ear canal is completely bloody at this point by her having to do this. She's getting more frustrated. She meaning my attending. And if you don't fish it out, like if you can't get it out, which often happens, you just leave it there, and you have to go tell this family that their kid has an ear tube stuck in their middle ear.
Floating in their middle ear. Yeah.
Yeah, and it will just stay there. And fortunately, my attending did get it out. She had to make a huge other incision in the eardrum, which may or may not cause a prolonged perforation down the road. I don't know, but I just felt terrible. And I don't know about you, Eric. When these bad things happen, sometimes it just is like the first domino. It threw off my whole game for the rest of the day. I was doing routine things and like questioning, like, can I do this? And so this is tough. And this is not the first time these things have happened. You shared one in med school and in residency, or sorry, undergrad and in residency. I'm sure you had things in med school too where you felt silly. I mean, I'll throw the question back at you now, Eric. How have you dealt with these things? Like when things go south, you're feeling embarrassed, you're feeling down. Like what's kind of been your go-to to process?
Well, I think there's different like I was thinking about this before we jumped on, because I think there are kind of different types of things that you can fail at,
Yeah.
And there are some principles of like, you should do this all the time, anytime you fail. And it's an important part of kind of processing things. And there are other things that I am not sure if I have a great answer for. So for example, like, yeah, I mean, it depends on what you're failing at. Like, I feel strongly that, I like academics and I'm good at taking tests, right? A lot of us are, or we like make ourselves into good test takers. Anyway, my point is like nothing in life no one is perfect in life, right? It's impossible to be perfect. But the fact that you can go into an academic setting and take a test and that there is a possibility of 100% score that is perfect, like it just is so unreal. You know what I mean? It's unlike anything else in life. And so I just think that's frustrating. That's not answering your question at all. But I think that's frustrating because like we deal like so much of our identity as undergrads and in medical school as well as like based around our scores and things. Like that's what we chase after so we can position ourselves well for good medical school and good residency. And like it's just not real, like there's so much more when I see patients and you could talk to 4 different dermatologists about a patient with scleroderma and they would each treat them differently. And so while like in academic training you're expected to come up with this like there's a right answer, a lot of time there's not like a perfect answer. And so I think part of failure is recognizing like I think you have to be conscientious about what you failed at and recognize that like in real life it's not as black and white as being a failure or being a success is one thing. The other thing, and you kind of touched on this, is like, I think you have to be contemplative about what happened and kind of own up to that, right? Like you talk about owning up to losing this tube. When we were in this morbidity and mortality conference for us, like it's not I think in some programs, and I don't know what you guys are like, but like we don't have to necessarily present our own case of more like where we messed up, right? It's like some resident is assigned to like do the M&M case for the month, and then
Interesting.
They find a case, and that's who presents it.
Oh wow!
But like it was, no one knew it was me, But at a certain point, people were asking questions like, "Oh, what happened here?" And what was the story? And so I was like, "Yeah, this was me," like, and did I look stupid? Definitely, definitely look stupid. But I agree with like your perspective. I think you have to own up to the mistakes that you make, and it helps you to like feel the gravity of the mistake. Because I think when you kind of write it off, then it's easy to not learn what you should learn from those experiences.
Mm-hmm.
But when take the responsibility for the mistake that you make, or, whatever the case may be, like say, and I almost hesitate to make this example, but like say you didn't get into med school, you have to take some responsibility and say, like, what could I have improved upon? Like, where could I be lacking? What responsibility can I take for this? And I'm not saying that there's not people out there who don't get into medical school who deserve to get into medical school, because
Sure.
there are, and a lot of times those factors are outside of our control. But I think having that internal locus of control and accepting responsibility for mistakes when they come up is important for me to process those things. Because, like, I think we hold ourselves to a high standard, but like we're all in a learning process, right? And
Mm-hmm.
so the failure is part of that process of like starting from point A and like improving upon your skills and your knowledge until you get to point B. And sometimes it takes a few iterations and a few failures and things like that. But if you don't like accept that part of it at least may have been in it due to something that you did or did not do, then you kind of absolve yourself of the need to be better in any kind of form. And I think that's how I am able to cope with failure, is like I'm gonna take something from this experience and be better for it. You know what I mean?
Yeah. I think this can be a problem for a lot of pre-medical students as we've coached over the years. How many times have we sat with students who have taken an MCAT test and had a bad outcome? I mean, to be frank, a bad outcome, something that we always set goals with our students beforehand. And when they came back with a score that was far from that goal, sometimes worse than they had previously taken before. I don't know about you, but I had a lot of students who immediately would come up with a whole bunch of reasons, almost excuses as to why that happened. Like, yeah, the OChem test couldn't do it. Yeah, there was so much noise in the background. Yeah, the test, conditions weren't ideal. My test, was testing me on things that I didn't know. Um, there was like a laundry list of things that would come up. And to your point, if you don't really own up to what happened, it's hard to make change. It's hard to kind of sit back and really process what went wrong, what can be changed for next time. And instead, you're kind of focusing on things that are way out of your control. And to your point as well, like there are things that happen. I remember on my MCAT day, I've told this to the listeners before, the person who was running my test was completely clueless. They did not bring me a marker to take notes. They came in super late after every break. And there was a point where I didn't even get a break because I was sitting there raising my hand. And there's all these opportunities to just kind of accept that these circumstances are driving your situation. And I think if you train that way, when you get in these moments where it is out of your control and many things you just collapse, and that's not what you want. That's not what we want for you. So I I think it's a really good point. This locus of control problem. Look at Eric teaching us MCAT principles as we discuss this.
Well, I found myself wondering, have you talked about like your anatomy yet on one of these?
My anatomy.
Ear anatomy. I was just thinking about middle ear with your.
Oh, yeah, that'd be great.
We should do that. We should
That
do that.
would be a great idea. Okay.
Relevant.
Tabled. Yeah, absolutely. Um, yeah, I mean, Eric, kind of want to get your thoughts on you know principles of getting through this and talking it through. I think I've often had to confide in people when I failed. I think normalizing the situation, at least to an extent, is really important. we all make mistakes. We all have bad MCAT tests. We all dunk tubes. If you're an ENT resident, everybody's done it. But I tell you, like, nothing felt better in that moment than going to some of my other senior co-residents and like telling them my experience, and them having told me, like, dude, I've done this 5 times. You're gonna be fine. It's almost a rite of passage. The patient's gonna be okay, even if they can't get it out of the middle ear. They're gonna be fine. It's just silicone. That to me is incredibly comforting.
Yeah.
And it's happened throughout my entire medical journey where I've had to rely on other people. I've called you before and been like, I'm struggling with this. And I remember you called me before step 2 because I had taken it and you were concerned. Like, you were like, I think we had scored under what you had wanted. And I'm like, you're going to be fine. Like, we've all been through these things. I'm curious, like, how you've navigated confiding in other people when these bad things have happened.
Yeah. I mean, I'm one not necessarily to find like a person that I trust implicitly,
Yeah.
but like to find someone who, and you kind of allude to this, but like someone who is almost like an authority figure to you
Yeah.
in the space in which you failed, if that makes sense.
Yeah.
Right. So like when I was in the lab and I messed up that stuff, like I talked with the graduate student who I was working for, and I talked to the PI who was, ran the lab, and had conversations with both of them about like, what what should I have done differently? And like where do I go from here? And like what should I be taking away from this, right? Because I think there's some degree of perspective that comes with seniority that allows them, like you said, I think it would be easy to kind of spiral with when we're so used to like holding ourselves to such a standard and doing well and everything. And I think for them to be able to say, oh, everyone dumps a tube. Is that what you said? Dumps a tube?
Dunk, like slam dunk, man.
Dunks a
Dunk
tube.
that
Okay.
tube, man.
Everyone dunks a tube. It's not a big deal, right? Then you can be like, okay, here's someone, who's been there,
Yeah.
who has seen this happen with people before, who's made this same mistake, and they're telling me that it's okay, and then, subsequently they can tell you can talk to them about, what should I be doing differently? Maybe they say, it just happens. It's okay. You're doing great. You don't need to worry. Or maybe they say, yeah, you need to, be more considerate of your, fine movements, or I don't know, whatever it is that makes you dunk a tube. But like so I guess for me, and I've done this, dozens of times over the last few months, is like go to one of my chiefs or go to one of the residents, even someone who's just a year ahead of me, and say, here's kind of what I'm dealing with. And I think we're lucky in medicine in that people go into medicine to help someone, I think almost pretty much invariably. And so people are willing to talk with you and help and be, non-accusatory and not judgmental, at least, among our generation. And so I think it's not a hard thing to say, like, can we kind of debrief? And people are willing to take the time to talk to you. Is it unhelpful to go to someone outside of medicine or, your field or whatever? No, it's not unhelpful. But for me, I think it adds some perspective. Anytime I have an experience of failure or something like that, I always talk with my wife about it. And that's helpful too, and she's a therapist, so it's like especially helpful. But it's, to me, it's like a different experience. And I think what's helpful for me to be able to kind of absolve myself is to get that perspective and experience to say, this is okay. Or if it's not okay, to say, this is not okay, and here's why, and here's what you can do. And then you have kind of an action plan. And I think maybe it's a coping mechanism, maybe I'm like intellectualizing. There's another MCAT topic for you.
Man, this guy's dropping them.
That I'm like not wanting to, deal with the weight of the failure. And so I'm trying to make it into an objective, right? Maybe that's, just one coping mechanism way to do it. But that's kind of how I look at these things, because I think you can't label yourself a failure, right? Like failure is an event that
Mhm.
happens to everyone. And so I try to use it as a stepping stone. It's funny, like I feel funny talking about it in this way because I'm like presenting myself as an authority on failure as if it's something that I don't do anymore. But I feel like I fail at something every single day.
Every day.
And so it's like, we're in the trenches with you guys, we're
Yep.
and like, I think about like MCAT questions or, skin disease topics, the things that I'm learning now. Like you fail something every day. There's something every day that you do a question on that you don't know the answer to.
Hmm.
And that's how you learn it, Like I know when I was a lot of people will use UWorld in med school, and I think UWorld has like MCAT
Yeah.
platforms too.
Yeah, they do.
But principle being like do practice questions to learn principles. And I always felt like the questions that I got right, like I may or may not remember that topic. Even if it was something I guessed on, if I got it right, I was kind of like, that's fine. Like I know it well enough to guess it right, But if I got it wrong, if I get something wrong, I'm like, okay, here's a topic that I don't know because I got this
Yep.
wrong. And that like that event of failure is like an inciting, like you need to remember this sort of experience. So to me, it's like it's almost a good thing because it gives you a reason to do better. Does that make sense?
Yeah, that's our negative experiences always make, I think, more of an impact for good or bad, I think, in learning a good thing. Um, I can tell you just from taking out tonsils, that is something that seems routine um, for like an early resident in my field, but I can remember vividly each kid where there's some principle about that procedure where I had to learn the hard way. And it almost
Mhm.
every time I'm doing a tonsil now, I can almost see that child's face. And none of these kids were hurt. But I remember the first time I got too deep in the tongue base when I was taking out a tonsil, and there was so much bleeding that I had to ask my attending to help me stop it. I remember the specific patient where I went too lateral. Um, and I started to get into a lot of bleeding. I remember I went too superior and lost a lot of the anterior pillar. There's like these negative experiences sometimes really sting in the moment, but they do help going forward, changes behavior.
So my question for you though is, and maybe you've had an experience like this and maybe you haven't.
Mm-hmm.
Like, and I kind of touched on this at the beginning, but what if it's something that's not necessarily like I'm gonna learn a principle from this? Like I keep coming back to this, like, what if you don't get
Yeah.
into med school? And we
Yep.
have people rotate with us who dermatology, you do an intern year that's separate from your derm year. And so we have
Mm-hmm.
people rotate with us who are interns currently, who didn't match into derm. And so, like to a degree, you're like, okay, what can I do better? How can I improve my application? But also it's not like okay, I'm gonna remember not to go too laterally on this,
Yep.
tonsillectomy because I don't want to run to bleeding. It's not like a one-time minor thing that you're gonna then take some important pearl away from. It's like this was a serious blow to my plan, and it's not like a thing that you need to learn. It's like a thing that you need to get done. Like getting into med school is not
Yeah.
something you're trying to learn how to do. It's just something you're trying to do. So I don't know. I've been thinking about that a lot. And I don't know if I have a great answer of like how to approach that.
I think it's important to set up expectations. First and foremost, it's going to sting. There's no way around it. You can't sugarcoat these things. And if your expectation is that I'm going to get through this without it hurting, I think that leads to more problems. If you don't get into medical school, you can't sugarcoat that. It's going to be a really sad thing. And I do think it's important to normalize if you can. A lot of people don't get into medical school, and a lot of people go on to become doctors. And if you can't lose hope when something so derailing happens, um, And I think some of the other principles we've talked about come into play, like finding an authority figure in the thing you failed in. Go find a physician who did not get into medical school the first time. There's a bajillion. There's probably, for every example of these things that we could fail at, and they, to your point, may not have the most educational value to them, there's somebody who's overcome it. It's really important to get a hold of that person and seek them out. Also, I think the other thing I would say is, because it's going to sting and there's no way around that, I think it's important to understand how you cope with things and try and get yourself to a good mental space to heal. For some, that might mean, completely taking time off, because any sort of thought toward the failure could put you into a worse spot until you have some time to heal. For other people, they don't want to stop working until the task that you had mentioned, Eric, is done. Sometimes it's a combo of both of those things. But I do think people need to find, in any of these situations, whether it's a tonsil, whether it's not getting into medical school, whether it's dunking a tube, you have to find out how you best get yourself in a state of healing. This is really crazy, but I remember somebody in med school asked me how I was dealing with, having a child and trying to do well in med school and trying to apply and all these things. And I said, I watch a lot of Netflix. That was my response. We've talked about this before on the show, but I think it comes into play here because, like, that is one of the things that I do that restores balance. The moment I got out of that hospital and I was feeling like absolute crap, I came home to a spot, my kids had already fallen asleep, and I just wanted to, like, not think about it. I wanted to throw on some comedy that made me laugh and get back to the grind tomorrow. That's just my way of coping, but I've learned that that's my way, and that's okay. What do you think, man?
What?
About, like,
About dealing with those sorts of failures?
yeah, that don't have as much educational value to them,
Yeah, I don't know. I think I don't know if I have a great answer. I don't disagree with anything you've said. I think part of it is kind of a reframing, like an opportunity to, like, revisit your goals, I think, is what kind of one of the conclusions that I'm coming to.
Yeah.
And part of that is, like, meeting with someone, a mentor or a friend or whatever, and kind of talking it through. I think part of it is some introspection of, like, what do I really want? And this is very, like, med school centric, because that's the example that we're giving, right? If I could think of another example on my feet, I might use an example. But, like, do I have to go to a top 20 school? Did I apply to DO schools? Did I apply to Caribbean schools? Maybe you need to widen your net. Do I have to be a physician? Could I be a PA? Is it okay for me to do that? If I could still take care of patients, I can hop around specialties. I have that opportunity. Do I really want to do emergency stuff? Is that what it's all about? Maybe I should be an ENT. Or, do I want to get into research? Like, is that what I'm passionate about? Maybe I should do a PhD. And I think, that's probably not the answer that people want to hear. And I'll be honest, Jayden, I don't know if I've had that sort of failure experience. I probably could think of something if I sat here for another 5 minutes and thought it through. But because of that, it's easy for me to say, like, oh, here's how you reframe it, But I think in practice, it would be a very difficult process. I do remember, well, I was going to share a story about a friend of mine who kind of had a similar experience, but I won't get into their personal life for their own privacy reasons. But I do think there's some value to that. I think that people can become frustrated if they try to do the same thing over and over again without kind of changing things up. And so I think you can either, change your approach and what you're doing to achieve that goal, or you can kind of change the goalposts and say, what is my real ultimate end goal, and how can I achieve it? Because maybe there are different ways about going about that kind of process that I want to get to. But I don't know. It's a good question. It's something that we all kind of deal with and we're all struggling through. I will say, that in a shameless plug for Jack Weston, I think one of the more helpful things for me as I was applying to med school was the mentor that I had kind of gotten, the tutor that I met through my MCAT study program. That we did some one-on-one tutoring, and he helped me a lot getting ready for the MCAT, and he kind of was helping me through the process um, of applying to medical school. And we are more than happy to talk with you guys about your experiences and walk you through creating study plans for the MCAT and teaching you specific principles if that's what's going to be helpful for you. And helping you when you fail or do poorly on a practice exam. We're here for that. If you guys feel like it would be helpful.
Yeah, and I can't second that enough. I think the key there is failure is going to happen to all of us. It's going to happen in different ways, but honestly, good mentorship in any stage, I do think minimizes failure, but also does help you cope with it when it happens, does help you reevaluate goals when it happens, and helps you improve from when you go forward. I couldn't overemphasize this. Good mentorship is so key. I think a lot of people make mistakes because they don't have somebody, or they haven't yet sought out somebody to kind of teach them how to do something right, whether it's at the pre-med stage, the med school stage, residency, attending, you name it. But also, like, because these things are going to happen, we've stressed the importance of like talking it through, having a person that you can go to in your field or in the same ballpark as where you may have fallen short. It's really, really helpful. And for a lot of our listeners, at this stage, it is getting somebody who you meet with one-on-one, in a formal and an informal fashion.
Yeah.
So.
Well, beautiful. Any other thoughts, Jayden, before we close?
No, my heart goes out to everybody. This isn't an easy pathway. Eric, it seems from our friendship that you worked really, really hard, but it seemed like you had a fairly smooth trajectory to success on the tests. You had a strong background in taking tests from the beginning, and I think that's helped your students a lot over the years, your expertise with standardized tests. And mine wasn't particularly bumpy, but I think both of us can say there were moments during our journey in the MCAT where there may have been times where we doubted what the end result would be, and that's totally normal. And we're here for you at Jack Weston.
Yeah, that's a beautiful sentiment, Jayden. Thank you. Very kind of you to think that I had a smooth trajectory. I would just add, the longer I do this, medical education, the more I'm like, just get comfortable with being uncomfortable, and failing, because you're going to keep doing it. And
Yeah.
it starts with the MCAT. Hopefully you don't fail on test day is our hope. And, like Jade said, we're happy to help you guys with that. But it's like, it's a process. You start from somewhere where you don't know things, and you kind of fail your way upwards as you do things wrong, and you learn a new thing, and then you do some studying. And I just don't know at what point it will be when we don't fail at anything anymore. It's unlike other professions, I think, because there is so much to know and so much to be able to do, that you just have to be willing to be okay with not being perfect.
Yeah.
And it's hard because the stakes are high and people expect us to be perfect. But learning to kind of give yourself some wiggle room, and being able to brush off some of those mistakes and learn from them is an important part of the journey. So you guys get started now and reach out to us if you want to talk or need any help with anything in particular. And and we'll be around. Right, Jayden?
You got it, man. Thanks,
All
guys.
right. Good luck studying, everyone.